Hello! I got a request for what do I do about calcification of the heart? Now, I'm not quite sure if he means calcification of the valves or calcification of the arteries or exactly what, but we're going to start a little bit of a conversation on just calcium metabolism in general first, then we'll get to the specifics. Calcium metabolism is actually more complex than most people think. Nearly every single organ and gland in your body has something to do with calcium metabolism. Okay? Most commonly, calcium problems occur with bad digestion. If you can't digest the calcium, of course you're not going to be able to absorb it. If you have a gallbladder that's missing or under functioning, then you won't be able to metabolize calcium either. So let's say you're full of yeast infection, well, you still won't be able to absorb the calcium well. Well, let's say you're magnesium deficient, and lots of other things going on. There's so many things to do with calcium metabolism. But when it comes down to, hey, doc, I got calcium somewhere it's not supposed to be. Maybe it's in the aortic valve. Maybe it's in the arteries. Maybe it's a kidney stone or a gallstone. Well, then we got to think, well, why is the calcium not going where it's supposed to go? Now, calcium needs to be in balance with phosphorus. If you have too much calcium and not enough phosphorus in the body, well, calcium will just basically go into the tissues to keep that calcium-phosphorus ratio right in the blood. So calcium will just get packed in places. A classic sign of this is if you tend to have a lot of tartar built up on your teeth. This is why I check every patient's mouth when they come in. I'll see patients, they have so much tartar on their teeth, I'll say, when was the last time you went to the dentist? And they said, a month ago. Well, heck, you got calcium going into places it's not supposed to go. You probably could benefit from having more phosphorus. So Serum Process has phosphorus as a food. It's a liquid. It tastes terrible, which is why the instructions say to mix it with water. Now, I usually recommend Circuplex, which has a lot of phosphorus in it and also benefits the circulation in general. That's what it's named for. So if you have cold hands, cold feet, maybe you got pale eyes because the blood flow is just not flowing, Circuplex is a great product for that, and it'll also help pull some of that calcium out of the tissues that it's been deposited into just because of that phosphorus that's in there. Now, once it's in solution, well, how do we get it to the right place that it needs to go? So we already talked about Cataplex F in the last video. Vitamin F, or the fatty acid cofactor, latches onto calcium and pulls it into the tissues. So, like I said, that's just really simple. Simple place to start. If you got calcium deposited in places it's not supposed to be, bone spurs is another classic one, then benefit from phosphorus. I forgot to tell you guys the most important thing about phosphorus, which is where to get it in your diet. Royal Lee, the guy who invented all of these awesome products, said, don't buy my supplements, buy good food. So I want to give you what you need to know what to eat. If you do need more phosphorus in the diet, because you're throwing calcium into places it's not supposed to go, it's really easy to remember, phosphorus always comes with protein. So if you eat more protein, you're going to get more phosphorus. Of course, red meat is the one that everybody talks about, but red meat, chicken, fish, nuts, all super high in phosphorus. And most people don't eat enough protein anyway. So if you don't want to spend money on supplements, go buy a steak. It tastes way better. Go ahead and send me any more questions that you guys have, any conditions you might want help with nutritionally.